Assalamu alaikum. I'm going to discuss today the sensitivity issue that a lot of people have when they are doing their restorations. I want you to basically understand something, and the principle is that in a cavity prep, let's say this is a class 1, you're going to go through the enamel, end up in dentin. These are the enamel rods, schematics of the enamel rods in blue and schematic of the dentinal tubules in red. When you're acid etching this after preparation, what is going to happen is that enamel rods with the bevel right here, the bevel right there, enamel rods can be desiccated. They should not be desiccated, but they can be. Comparatively, dentin should never ever be desiccated, because what happens is you have live fibers on the inside. If you desiccate them, they dry up, and when you put the adhesive on, it gets sucked into the canal, into these dentinal tubules, and that can irritate the dentinal tubule fibers. So here is a key: you prep it, you acid etch it, no more than 10 or 15 seconds on the dentin. The acid etch, I use a syringe and I apply the etchant to the enamel only in the beginning and wait about 5 seconds or so, then go in and apply it to dentin and then wash it away. So dentin should be etched for 10 to 15 seconds, enamel about 20 seconds. And this is how you do it: you apply the etchant to the enamel first and then to the dentin, and then you wash it away. When you wash it away, make sure that you don't desiccate it. Let's say it became dry, take an adhesive brush, pick up a little bit of chlorhexidine and rub it in. It has been known that chlorhexidine is not only a disinfectant, but it increases the bond strength. Now you take the adhesive on a moist level dentin and you apply it and rub it in. When you're rubbing the adhesive in, you will realize that the adhesive pools at the depth. So make sure you lightly blow it, not heavily, so there is no undercut which has been compromised by the adhesive itself. The key would be, do not desiccate the dentin. And once you have the adhesive there, you cure it. And you have cured it, now you start packing the composite. A lot of times I see that people pop in the composite and there's a bubble left inside. So the composite is there, but not into the retention grooves or retention curvatures on the inside. Sometimes the retention could be really sharp on the inside and the composite doesn't get in. So I would start adding the composite on one side and flow it with your instrument. I'm not talking about just a flowable composite, but even packable composite. Get it nicely inside and do it in sections. You put composite, pack it in, cure it from this side or cure from the side, and then you start packing the other side. Make sure you get this inside. All the composite should be touching all of the dentin. Even use an amalgam condenser to lightly pack it inside, and then you cure it. Then you put more composite here and more composite there. Then you put more composite and more composite, and this way you get a central groove as well, and you have cured it all. Try this and you'll be surprised that you do not have sensitivity. Secondly, here I showed you a little bit extra right there. If the composite gets on top of the enamel, make sure you do check with the articulating paper right at the cavo surface margin if there is any extra composite, or let's say on a cusp right there. Even if you have a layer of adhesive, that can cause post-operative pain and sensitivity too. So make sure you use a composite polishing burr, not a diamond at all, because you want to polish away that adhesive and you want to polish away the surface to make sure that you have the same original surface before as you started compared to when you finished. If the patient comes in with pain afterwards and I have packed the composite right, I have to make sure that there is no adhesive spots anywhere, and a simple composite polishing burr takes care of that. I hope that helps you.